My refutation speech is on the Affordable Care Act, and I'm going to start with a definition because my opponent did not state one. And according to Medicaid.gov, the Affordable Care Act provides Americans with better health security by putting in place comprehensive health insurance reforms that will expand coverage, hold insurance companies accountable, lower health care costs, guarantee more choice, and enhance the quality of care for all Americans. My opponent's three claims were that the repeal of the Affordable Care Act will negatively affect the healthcare system, that the second is that the repeal will hurt the working and lower class citizens, and third, that the repeal will negatively affect the economy. And my three claims are quite the opposite. That the repeal of the Affordable Care Act will positively affect the healthcare system, that the Affordable Care Act already hurts the working and lower class, and that the Affordable Care Act negatively affects the economy. So for my first point, the Affordable Care Act will positively affect the healthcare system. The Heritage Foundation, a political think tank, explained millions of Americans have already lost and more likely will lose their coverage because of Obamacare. The law has significantly disrupted the insurance market for those who buy coverage on their own by imposing new coverage and benefit mandates, causing a reported 7 million health insurance cancellations in 32 states in 2015. The same is true for those with employer-sponsored insurance. My opponent stated that with the appeal of the Affordable Care Act, that 19 to 24 million people would lose health insurance. But factcheck.org stated that 30 million people buy private health insurance, and insurance companies canceled a majority of their plans because their policies didn't cover the Affordable Care Act's 10 essential benefits. And for those who lost their private insurance, costs of replacing it are very high. The Affordable Care Act requires services that many people don't need, like maternity care. This causes issues for younger people who don't believe that they need all of these required services, such as maternity care or like extensive health insurance. So if they're younger, they believe they don't need all of these things, so it's more expensive for them to pay for all of this when they're very healthy and they most likely will use it. The Congressional Budget Office states that another 3 to 5 million people lost their company's sponsored health care plans, so even more people were out of health insurance. My second point, the Affordable Care Act already hurts the working and lower class. The Washington Post stated that the Affordable Care Act taxed those who don't purchase insurance. So if people can't afford insurance in the first place and still can't afford it after the Affordable Care Act, they have to go through a long, lengthy process to get the tax excused in case they still can't afford it. So they're still being taxed if they can't afford health insurance, as opposed to just not buying it. And my opponent stated that the Affordable Care Act gives big tax breaks to the most privileged members of society while increasing the economic burdens on millions of working Americans. But in fact, Obamacare contains 18 separate tax increases, fees, and penalties. The individual mandate, the medical device tax, the federal health insurance tax, and new penalties and limits on health savings account and flexible spending accounts. And those are just a few of the taxes that affect middle-class Americans after the Affordable Care Act. And there are two ways that the Affordable Care Act taxes people that can't afford the taxation. And you're either taxed with 2.5% of your total income or $700 per person, depending on your household. The Heritage Foundation stated, in spite of President's now infamous promise, the law increases the cost of health insurance. In 2014, the first year Obamacare's insurance mandates took effect, coverage in the exchanges was more expensive than comparable to 2013, where pre-Obamacare individual market in 42 states. For Americans with coverage through their employer, premiums also increased as family premiums for employer-sponsored coverage and have increased by an average of $3,500 since 2009. So this shows that even though Obamacare was enacted, it costs more than it did previous to that. So it affects the middle-class American. And lastly, the Affordable Care Act negatively affects the economy. The Heritage Foundation states that Obamacare creates $1.8 trillion in new healthcare spending, but uses cuts to Medicare spending to help pay for it. The law's exchange subsidies and Medicaid expansion will end up costing more than $1.8 trillion over the next decade. So this spending will actually put us in deficit, and we won't be gaining as much money through all the new taxes. We'll actually be losing money, so it won't help the economy. And my opponent stated that Medicare spending that Obamacare would increase Medicare spending by $802 billion over the next 10 years, which, if you take into account that we'll actually go into negative digits with Obamacare enact, and it'll probably add up to just as much, that it actually will negatively affect the economy. And for these reasons, I hope you see that appealing, that the Affordable Care Act enact is worse than if we were to repeal it. Thank you.
Okay, well, you spent time defining the Affordable Care Act. I'm not sure that that is of critical importance. Everybody knows what the issue is, and the definition that you gave is basically kind of just a label for what it's supposed to do. It's the particulars that I think matter the most. And on the particulars, you did a pretty good job. Almost everything, though, is counterclaim. There's not really much analysis of the argument that the advocate made. Instead, you rely on a counterclaim on every point, and you do a good job presenting information to support your counterclaims. I think you need to do a little bit more contrasting to the position that the advocate is taking. There was one spot where you did talk about the number of people who are going to lose coverage, and you compared that to the number of people who've lost coverage or might be losing coverage with the Affordable Care Act, and I thought that that was the closest that you came to doing the sort of thing that you need to do consistently throughout the presentation. You cite your sources pretty clearly. It's organized so I can follow what you're talking about. Like I said, the secondary points all basically are counterclaims to the advocate's claim. There's a little bit of awkwardness because you use the phrase appealing instead of repealing, and that's, I think, a little confusing. Most people, I think, understand what you're talking about, but if we just came in on the last part of the conversation, that would definitely be confusing. I thought the first two arguments are pretty well developed and explained. Your third argument on the impact on the economy is mostly dependent upon this $802 billion that's going to be spent. What you need to do is show us that the plan that is replacing it, or the one that is with the repeal, that we won't be spending that money, and I didn't really get any information that talked about that issue. So I think that there's some information that's missing there. Okay, thank you.